Hello, so this is cardiac surgery patient pre-op booklet, part 1, before and after care. Preparing for surgery. You will begin with an appointment in the surgical navigation unit to help you prepare for surgery. The cardiovascular surgeon's office will notify you about the date of this visit, which is generally a day or two before surgery. Please remember to bring a list of current medications with you. You may also receive a letter with additional information about your surgery from the surgeon's office. If you smoke, it is essential that you stop smoking at least 4 weeks prior to your surgery. This will decrease your risk of a surgical complication. Northern Light Eastern Maine Medical Center is a smoke-free campus, and no one may smoke in the hospital. People who continue to smoke are more likely to require a repeat operation. Before you arrive for your appointment, a nurse will call you and review your medical history and current medications. Talk with you about what to expect and answer any questions you may have. During your visit to surgical navigation, lab work, an EKG, and a chest x-ray will be done. Women will be fitted for a front closure bra. A member of the anesthesia department will meet with you to discuss your anesthesia. A nurse practitioner or physician assistant will also see you to evaluate your status and answer questions. You will be asked to sign surgical and anesthesia consent forms. You will also be asked to shower or bathe with a special soap. The nurse will give you both items to take home. It is also important not to eat or drink anything after midnight on the evening before your operation or surgery. It is a good idea to bring a family member with you for this pre-admission visit. We want to answer their questions too. Heart surgery is a team effort, and you are the most important member of that team. Please let us know what we can do to make this a smooth process for you. If heart valve surgery is planned, dental problems can place you at risk for valve infection and should be corrected prior to heart surgery. The day of your surgery. You won't be able to eat or drink anything after midnight on the evening before your surgery. However, your doctor may want you to take some of your medications on the morning of your surgery. Your doctor will tell you which medications to take. Take them with a sip of water. As with many surgical patients, you will most likely come to the hospital on the morning of your operation. The surgical navigation nurse will let you know what time you should plan to arrive at the medical center. After you arrive at the hospital, a nurse will check your vital signs and wait, and you will take a second shower or bedside bath with special soap. This soap kills bacteria on your skin and helps prevent infections after surgery. Before surgery, you will need to remove jewelry, makeup, hairpins, and glasses. A family member or friend should take these items until you need them. We may check your blood sugar even if you're not diabetic. Before you leave for the operating room, the nurse may give you medication that will make you sleepy. It may also make your mouth dry. You will also be given an oral rinse to cleanse out your mouth. If you wish, your family may visit with you before you are taken to the operating room. Check with the nurse to find out what time they should come in. Next, you'll be taken to the operating room. The operating room is a cool, brightly lit room filled with equipment. There are many things to do before operation. An IV will be placed in your arm and neck, and you will become drowsy and drift off to sleep while these preparations are occurring. Your family will wait in the Penobscot Pavilion Level 3 Surgical Reception Area. They will be notified when the surgery is completed, and your surgeon will speak to them at this time. Immediately after surgery. After surgery, you will be taken to the CCU, where highly skilled nurses are specially trained to take care of you. The CCU is filled with equipment that is used to help in your recovery from surgery. The equipment is used to monitor your recovery, and its presence is normal. The nurse will explain everything to you and your family. Your family may visit briefly about an hour after you arrive. The nurse will notify your family when they can come in. Waking up. When you wake from the OR, you may be awake or asleep. If you are asleep, an IV medication is used to keep you asleep for the first few hours after surgery. After that, the nurse will stop the medication and you will begin to wake up. When awakening, you may be startled or feel scared. This is normal. You may feel pain in your chest from the incision. The nurse will give you medication to help calm you and lessen the pain you may feel. The nurse will ask you simple questions in order to judge how awake you are. During surgery, many tubes and wires are attached for the purpose of monitoring how you are doing. Their purpose is explained below, or I have them explained in another video. Some tubes are attached to medical equipment which may beep or buzz. These noises alert your nurse to adjust the equipment as needed and should not worry you. Your hands may be restrained for a short time following surgery to prevent you from pulling out tubes or wires before you are fully awake. The restraints are removed once you are awake, and your breathing tube is taken out. Up and down. Your recuperation begins as soon as you leave the operating room. Generally, you will sit up on the side of the bed shortly after your breathing tube is removed. Later, you will sit in the chair beside your bed, and your nurse may assist you on a short walk. If you wear eyeglasses, please have your family bring these items to you after surgery.